Some prominent lawyers target makers of prescription opioids in a class action suit on behalf of Louisiana babies born with withdrawal symptoms. Sabrina Wilson has that story new at 5:30.
The opioid epidemic causes newborns to enter the world with hard to see and hear withdrawal symptoms. Incessant crying may be one of the kinder symptoms. It's called neonatal abstinence syndrome, related to infant drug withdrawal. Now some local attorneys are going after manufacturers and others in the opioid distribution pipeline.
The opioid crisis is the single largest industry-created health crisis that this country has seen.
They've filed a class action lawsuit in St. Tammany Parish on behalf of Tyler M. Roach and his child and babies throughout Louisiana born with NAS.
The plaintiff and class representative is baby R, whose mother became addicted to opiates when she and her husband and 5-year-old child were involved in a severe car accident.
The lawyers say the woman became pregnant while taking the potent prescription drugs.
She chose to carry the child, who unfortunately was born addicted, like her, to opiates.
The lawsuit names among the defendants some big name and recognizable companies as well as pharmacies.
Pharmacists have, under the law, obligations when dispensing narcotics, such as opiates, particularly or narcotics such as opiates, and the lawsuit alleged that they have violated their duties under the law because of just the sheer volume of opiates running through the pharmacies in Louisiana and out to patients.
The National Institute on Drug Abuse says every 25 minutes a baby is born suffering from opioid withdrawal. Last year, the Louisiana Department of Health filed its own lawsuit against a long list of pharmaceutical companies over opioids. Molly Demosthenes is a health policy expert at Tulane. She has not taken a position on the lawsuits.
I think you're seeing states, parishes, counties, local governments, everybody's trying to figure out a way to tackle the epidemic, right? And that means tackling the consequences of addiction as well as addressing the sources of addiction.
And then there are questions about the long-term impact on children born with NAS and the effect on society as a whole.
There are a host of long-term costs related not just to the treatment, but to the social safety net that's required to support children and families and really help communities that have been hit hard by the epidemic.
Baby R now suffers from developmental disorders.
The lawyers in the case want damages for not only the families of babies born with NAS, but also research institutions, treatment centers, and medical training. We reached out for comment from trade groups representing pharmacists today, but so far no one has gotten back to us. Kim?
All right, thanks, Sabrina.
We are in the midst of a medical crisis, a medical emergency.
Lawyers and doctors say a new lawsuit is the voice of babies born addicted to opioids. Good evening, I'm Natalie Shepard.
And I'm Karen Swenson. There is a rise in the tiniest victims of opioid addiction, newborns going through withdrawal treatment. And the cost of that treatment, along with their future health care costs, is skyrocketing. Medical reporter Meg Ferris joins us live uptown with more on a new lawsuit. Meg?
That's right, Karen. There is now a class action lawsuit that's filed for children across Louisiana who are born addicted. Now, it was filed in St. Tammany Parish only because they say that's where there are most of the babies who are affected. And attorneys and doctors filed the suit against pharmaceutical companies, distributors, and corner drugstores because they say the problem started with prescription painkillers.
We're asking in the lawsuit for damages for those financial burdens, as well as a lifelong medical monitoring so that issues such as developmental disorders can be diagnosed and treated as they arise.
The list of suffering is long and heartbreaking for the innocent victims of opioid addiction. Problems eating, sleeping. They can be irritable, fussy, have seizures, convulsions, tremors, nonstop crying. Lifelong developmental disorders, heart and cleft palate defects, anger and depression as teens. And like Kiona, 40% are turned over for adoption because biological parents are incapable of caring for children or are in prison or dead.
The problem's been here for several years, probably over the last 10 to 12 years it's been at its worst, and it's not gotten better in that time, it's gotten worse.
The suit claims that mothers became addicted first when they were prescribed painkillers for a medical diagnosis. A member of the team says the federal government has failed.
The states are grossly lacking funding for this national priority. This is exactly why we are here today.
Doctors say NICU nurses have to be specially trained for the unit. This one even has addiction training.
These babies stay in the hospital for 2-3 weeks, on occasion a little bit longer, and in that time they require sometimes intense care.
We are at risk for losing an entire generation to opioids. Our babies, your kids, and your grandkids deserve much better.
Now, the legal team made a point to say that if there is a settlement in this case, they don't want politics to dictate where the money goes. Let me read this list. They wanted to help children by going to academics, research institutions, addiction treatment, nursing training, law enforcement, emergency and DEA agents, and pill disposal so teens can't get old drugs that are left in their parents' medicine cabinet. Now, if you go to our website, we have a number where you can call if you feel like you this class action suit. Reporting live from the Uptown area, Meg Farris, Eyewitness News.
Meg, thank you.
And earlier today, several attorneys and medical professionals announced the beginning of a class action lawsuit on behalf of opioid-affected infants and children in Louisiana. The suit is brought against the manufacturers, suppliers, and pharmacies who supply, manufacture, and distribute opioid products. The reason they want to file the class action lawsuit here is because of the unique nature of Louisiana law.
The reason this suit was filed in Louisiana is there are many additional rights available to the citizens in Louisiana and those who bring suit here, protection under the Civil Code rather than the traditional common law which we find in other states.
It is a terrible crisis, and it tears families apart. It creates drug addict mothers that can't care for their children, and the hope is to basically treat people before birth and after birth to address the issue.
The neonatal abstinence syndrome, or NAS, is the medical name for the opioid addicted children. The suit is the first one in the nation like it. And those are your News with Twist headlines. Get them anytime on our WGNO News app. You can download it for free from iTunes or Google Play.
I am a big fan of this lawsuit, man. You know, this is an epidemic across our country, and the kids, unborn kids and infants are the most vulnerable. They don't ask to come here.
Right, it's not their fault.
And I've got to be born with this disease.
Right.
And I am
Yes.
This is not going to change until some of these drug companies and suppliers get hit in the wallet.
Yeah, I agree.
Yeah, we got to do better.
We've got to do better for sure.
Well, a new lawsuit is fighting for babies born addicted to opioids. The suit is filed against pharmaceutical manufacturers, distributors, and drugstores. Attorneys and doctors say the problem started with prescription painkillers. Babies suffering often have seizures, heart problems, and developmental disorders. And 40% are often turned over for adoption.
We are at risk for losing an entire generation to opioids. Our babies, your kids, and your grandkids deserve much better.
Now, the legal team says if there is a settlement in the case, they want the money to directly help the children.
Some attorneys and medical professionals announced their class action lawsuit on behalf of opioid-affected infants and children in Louisiana. They're suing the businesses that supply, manufacture, and distribute opioid products. There's a reason why they're filing the lawsuit in Louisiana.
The reason this suit was filed in Louisiana is there are many additional rights available to the citizens in Louisiana and those who bring suit here protection under the Civil Code rather than the traditional common law which we find in other states.
It is a terrible crisis, and it tears families apart. It creates drug addict mothers that can't care for their children, and the hope is to basically treat people before birth and after birth to address the issue.
The lawsuit is the first one of its kind in the nation.
A group of prominent lawyers targets makers of prescription opioids in a class action suit on behalf of Louisiana babies born with withdrawal symptoms. Local attorneys are going after manufacturers and others in the opioid distribution pipeline. The suit names some recognizable companies and pharmacies. It also calls for damages for families of babies born with opioid withdrawal and research institutions, treatment centers, and medical training.
A group of attorneys and medical professionals are filing a class action lawsuit on behalf of opioid-affected infants and children in Louisiana. They are suing the businesses that supply, manufacture, and distribute opioid products taken by mothers who birth children with neonatal abstinence syndrome, or NAS.
The reason this suit was filed in Louisiana is there are many additional rights available to the citizens in Louisiana and those who bring suit here.
It is a terrible crisis, and it tears families apart. It creates drug addict mothers that can't care for their children.
This suit is the first one like it in the nation.